Good afternoon, everyone, and thank you for joining me today for our webinar on understanding Ministry of Health and Long-Term Care reports. Now, each and every single one of you, doctors and staff alike, are receiving reports on a monthly basis to show what's going on in the practice. From a physician standpoint, what are you billing? What are you getting paid for? On the staff side, if you're submitting the billings, making sure that everything that you are submitting is getting paid, looking through error reports, and everything like that. So what we're going to do today is go through the main reports that come through on a monthly basis through your MCEDT account, give you just a high-level snapshot of what they're all about, how Cirrus can help, and everything like that. So if you do have questions, please do hold them until the end. My contact details will be provided, and I will be happy to answer any questions that you have. I do see that we have a lot of current clients, a lot of potential clients, hopefully, and some people who I've been speaking with recently that are considering our services. So hopefully this will give you a better understanding of what we do, how we do things, and hopefully give you that little push to move forward and get the help that you might be needing. So let's go ahead and get started. As well, we will be recording, so if you do have any questions, we will be able to answer them afterwards or provide you with a copy of the recording. So for those that are new, as we do have a lot of new faces, we are founded back in '94, headquartered in Toronto. There's two major components to our business. One is medical and dental lease negotiations, which we do well over 500 per year. And then the healthcare consulting division, and what that does is, which I'm the manager of, we provide billing support and operational support for physicians at the group and individual level. So, if you're an individual physician in a FO, no problem, give us a call, we're happy to help you. Or if you're the lead physician and want to get your whole group involved, great, we're happy to do that as well. So no group too big or too small. So the main purpose of today's program is to give you an increased understanding of the MOH reports, and to leave you with a clear picture of how Cirrus can help you. Now, we want to make sure that you guys have a clear picture of what you're getting, why you're getting it, and what to do with it. So the four main reports that are sent monthly to your MCEDT account are your Remittance Advice, so your RA, your outside use reports, your error reports, and your roster reports. Those are the main ones that people are going to be looking at or should be looking at on a regular basis when they log into their account, either themselves or their staff. Now, what is the Remittance Advice giving you? It's a summary of your monthly billings and how much you are being paid for each revenue stream within the FO model. So it's a report that's coming that's showing exactly what you're getting in capitation. We're going to go through this, but exactly what you're getting in capitation, how many patients you have, what was your outside use, from a dollar perspective, and any other premiums that might have been paid, and so on. So there's a lot of useful information in there, but it's very confusing to look at. And, we've been looking at this for many, many years, and even for us sometimes there's that little thing that the ministry slips in there that nobody knows about. But that's what we're here for. We're here to identify those issues and give you a clear picture and give you that understanding of what it's all about. The outside use report, so every month you're getting a list of your patients that are going to the walk-in clinic and what is being billed at the walk-in clinic. Very simple, but not very useful, and I'm going to show you why and how we can help with that. Error reports, again, you're submitting your billings, things are getting rejected for various reasons, whether it's a health card issue or stale dating issue or submitting the wrong code in combination with another code. So there's so many different things that can happen that we want to make sure that you guys know what's going on. And then of course your roster. So who's coming on your roster, who's coming off in any given month, and who's there all together. So let's start with the ministry RA. So this is a snapshot of the first page that you're going to be getting, and that's the top section there that gives you that sort of breakdown of what you're getting in capitation, what are the deductions that are coming off, what's your blended fee for service, which also stands for shadow billing, which some of you may not have known, some age premiums. Now, looking at that, people are going to say, well, I don't understand. What is this? Why am I looking at this? Why are things being separated. You know, what's a base rate payment adjustment, and what's a network-based payment, and what's a comp care? What's the difference between all of these? This is what the ministry is doing. There's so many numbers. It's so unclear as to what's being presented here, but from a high level, it's showing you your total check amount up at the top corner there on the right side. It's showing you a breakdown of your capitation, both the network and the comp care. It's showing you, as I said earlier, shadow billing. It's showing you, you know, what are the ministry discounts. But it's not in a presentable format, and it's very confusing. And we will help you understand this on a regular basis. And again, some people are going to say, no, I don't care about it. As long as I get my deposits, I'm good. And that's okay. But from our perspective, from our history, it's better to know what's going on day in and day out within your practice. Another section on your RA is going to be about your group summary report. So for the leads that are here with us today, you guys want to be looking at this. What is the group getting on a monthly basis for total capitation? What is the group getting in the GMLP, the Group Management and Leadership Payment? That's $1 per patient that's rostered to the group to a max of $25,000. Are you guys getting an office practice administration payment, the OPAP? If you guys are, you know, 5 physicians or more, there's either $12,500, $17,000, or $25,000 that you guys are going to be getting or eligible for. Has your group signed up for that? Are you taking advantage of what's available to you? Again, this is more on the group level, so not as relatable to the individual physician, but still very important information there. Here is your summary of categorization of claims. So this is showing, as you can see on the left side there, your pre-network, which we truthfully have never seen anyone get anything for. WSIB claims, if you do have any. There's a handful of physicians that we work with that get that, but not very many. Your enrolled patient excluded. So if you see that on the left side there, enrolled patients excluded codes. That's your out-of-basket codes that you're getting. That's your fee-for-service. So all your diabetics and your smokers, that's going to show up in that section there. Your network colleague, if you're in a FO and you're seeing your fellow FO patients from a physician within your FO, that's where it's going to show up. And then your non-enrolled. And non-enrolled here is going to have included and excluded codes. So if you're billing an A7 on a non-rostered patient, that's going to show up in the included. And if you're billing diabetic code on a non-enrolled patient, that's going to show up in your excluded. So again, this is very useful information to know what your fee-for-service payments are on a monthly basis and how they're broken down. Again, it's not easily readable. It's not in a user-friendly format, but the information is there. It's showing. It will also show if you're billing outside of your clinic. So, you know, the 4 zeros that you see there right in the middle there, that pertains in 99% of cases to billings that you're submitting within your FO. When you submit in your office, you're using the 4 zeros plus your billing number. If, for example, you're a locum, you're going to use the B group identifier in your billing number. If you're working in a walk-in clinic, there's usually a four digits representative of that walk-in clinic. So it really depends on the location, but it will break down and show you where all the money is coming from. And that's something that we provide to our clients on a monthly basis. Here you're going to look at access bonus, so the group LTC and group non-LTC. Again, something that some groups may want to look at, you know, if you're on the positive side, just for a lead physician to see as a whole what's going on with the group, or for an individual physician to see how the group is doing as a whole, great. You can see what's going on here as well with regards to access bonus. Now here's a little bit more information for the individual physician. Now what this is going to be showing is your blended fee for service, as you see there, which is your shadow billing. So that's the 15% that you're getting on a monthly basis for all in-basket services that you're providing to rostered patients. Then you have your base rate, so that's part of your capitation, and your comprehensive care payment, which is the other part of your capitation. So those two together make up your full capitation payment. But again, they're breaking it down into multiple sections. If there's an adjustment, that they're going to do that, and so on. So they don't add it together for you. You got to figure that out on your own, so to know, you know, if it's right or not. The discount on there now is one part of the ministry discounts that's coming off on a monthly basis. Unfortunately, nothing we can do about that. And then it's showing your individual access bonus number. So if you have long-term care patients, it's going to show there. And then for everyone else, non-long-term care access bonus. So it's going to show you what your maximum special payment is, what your enrolled patients outside use is, and then the sum of the two. So you take your max special payment minus your outside use, and you get what your access bonus calculation is going to be. So again, this is fairly easy to read, as I've been going through it. But again, I do this on a regular basis. For some physicians, especially newer physicians who have never seen one of these before, or new staff, this can be quite daunting to look at. When you receive a 20-page RA every month, and you have to go through it and figure out if your doctor has gotten your payments, or if the doctor is looking through it and making sure that they've gotten their payments. It's a lot of work that has to be done in most cases, and that's what we're here to do. So something that Cirrus provides on a monthly basis is a monthly RA summary. Now, what this snapshot here is one page from our RA summary, and this is showing the revenue breakdown year over year. And what we typically do is we compare ministry fiscal years. So we're currently in the 2017-2018 fiscal, as we just started beginning of April. What our report is going to show, what did you earn last year on the 2016-2017 fiscal, month over month? And what did you earn the previous year in the 2015-2016, and the year previous to that, the 2014-2015? Why do we do this? We want physicians to understand how things change in their practice. If it's an older physician who has been slowing down, they want to see where has it really been impacted the most. Are they seeing less patients? Are they having less patients on their roster because people are passing away? If they have an older roster, if they're an older physician, maybe they've had these patients for a long time. There's so many variables that come into play that need to be looked at. And what we do here is provided in a nice summary format. So we have the capitation payments, both the base rate and the comprehensive care. We break it down, but we also sum it for you. We have what your roster size is, how much you're getting paid per patient. So on average, this physician here is earning $212 for the current fiscal and $213 for the previous. So they've lost a few patients. Perhaps I know it might be a little bit fuzzy to read. I tried to get it as clear as possible. But you want to know how much you're earning on average per patient. So if you do decide, hey, you know what, I have a little capacity for a few more patients, how much am I going to earn on average if I add 100 patients or 200 patients or 500 patients or however many that I want to look at? Fee-for-service billings also, we're breaking down what was in that section on the RA to show you your enrolled patients, your non-enrolled patients, your network colleagues, and your WSIB. It's very nice to have in one format, one clear format, in one location, everything that you've been doing. Your access bonus as well. What's your max special payment? How much outside use? What's the actual payment that you should be or that you're averaging on a monthly basis? Any preventive care bonus, any special premium bonuses, anything like that we're going to be outlining here. The next page of our report shows a month-over-month breakdown for the current fiscal year. And the reason we do this is because things change monthly. There's some months with 30 days, some with 31, February with a little bit less, 28. And we always get the question in February, why did my income drop? There's almost 10% less days in the month of February, 3 days less than a 31-day month. So you're going to lose out about 10% of your capitation, and that's really going to take a drop there. So from that perspective, it's very important to know what's going on a monthly basis. If you took 2 weeks off, 3 weeks off, or a month off, how is your income impacted? Obviously, you're still receiving your capitation payments, but how much did you lose in shadow billing because you weren't seeing your patients? How much did you lose in fee-for-service billings because you weren't seeing your patients? You can then predict and plan for the future. If you know that you lose $10,000 because you were away for a month, okay, no problem. If you need to be away for another month in 6 months from now, you can plan that. You'll know that you're going to be out 10 grand. You can adjust accordingly if necessary. This is a very easy way to read what's going on within your practice on a high level in a snapshot view all at once. Looking at an RA on a monthly basis, that's great. We definitely encourage it. looking at the what's deposited into your bank account on a monthly basis, very important to make sure that everything is being deposited. But at the same time, you want to see it all together. You don't want to flip pages and back and forth, and your staff doesn't want to do that either. So having this as a whole overview is very, very useful. Another part that we have on our report here, I apologize that the headings didn't show up. I don't know why that happened. But anyways, this is a chart, a demographic chart. So this is showing all the patients that a physician has in all age categories, and the breakdown between male and female. So the orange and blue there is male and female, blue for male, orange for female. And those lines going through the middle, the bluish-gray ones, is the capitation amounts. And you can see that, babies earn, give or take, just under $200 per year, drops down very low for males and females about the age of 14. For females, it goes back up again. That's the light blue line. And for males, it's the darker gray line there. It takes a little bit longer. It's your early 30s that it really starts to pick up again. But it's great to see, what are your patient demographics? Are you skewed more to the younger side? Are you skewed more to the older side? This is extremely useful if you're towards your end of your career and you're thinking about transferring your roster. Maybe you want to think about selling it, or there's another young physician that you want to give it to. Whatever the case may be, this is very useful information to have that you're not going to get on a RA from the ministry. So let's jump now to your outside use report. Now, you definitely cannot read that chart, and there's a reason why I put that in like that for you. There's a lot of information there that's not useful. The ministry is sending you a list of patients that says, this patient health card number went for this service, went for an A007, it was billed at $33.70, and this was the date, and that's it. How useful is that? If you see one patient show up on one outside use report, and you think, oh God, they went to the walk-in clinic, I need to de-roster them. Hold on a second, take a step back. These are very hard to read. It's only showing 1 month of data, and it's not statistical. You're looking at 1 month. You need to look at several months to see if there's a pattern or a trend of what that patient is doing. Because if it's just a one-time thing, you don't want to de-roster them right away because it's only $33. That's not a huge deal. No one's going to get 100% of their access bonus anyways. So what we need to do here is look at several months of data. And what we do here is look at your outside use over time. Our outside use management analysis looks at 6 months of data to show you the patterns and trends of your practice. And 6 months for us has been a sweet spot. We really find that this is extremely useful to show what your potential payments are at the group level, at the individual level, and what your outside use was. We look at the days of the week. What days of the week are highest contributors to your outside use? If it's a Monday, a Tuesday, a Wednesday, we can adjust and figure out why those days are happening. Why is the outside use incurring on those days? Is it just a handful of patients that are going to pain clinics or sports medicine or something with a focused practice designation physician that doesn't actually have the designation? It's important to look at the details, look at the stats behind what's going on within your practice. It's not so useful just to say, there's a patient that went for outside use, I'm going to de-roster them. You need more information than that. We also provide that cost-benefit analysis. What is the annual capitation? What is the prorated amount for that 6-month period? How much outside use was incurred during that same time period? And what you would earn back by de-rostering. And we use the rule of thumb, anyone greater than 100% would be more valuable off the roster than on the roster. And we provide a list of the top 20 patients to all our clients on a regular basis. Again, sometimes monthly, sometimes every other month, depending on the physician and depending on how bad their outside use is. We also provide the earliest date of outside use and the most recent date of outside use. And the reason for that is you want to de-roster back to the earliest date to maximize the benefit. If you're going to de-roster today, you're not going to get all that outside use that was incurred last month or 2 months ago or 4 months ago. You want to go back as far as possible within the 6 months to the date where it all began in order to get back all the outside use that was incurred during that time period. And we also highlight what codes were being utilized. So if you want to have a conversation with the patient to say, hey, Mrs. Smith, we know that you've been going for, addiction services, or, we know you've been having home visits, or, whatever the case may be, you'll be able to know what's going on and have that conversation, the educated conversation with that patient. Let's switch over now to the ministry error report. Now, again, this is the format that comes from the ministry. It's a bunch of numbers, a bunch of letters. No one really understands what's going on here. But what we're looking at here is the codes that are being submitted, that are being rejected, what's the rejection code on the right side there, and what's the dollar value associated with it. Now again, not many people are going to be able to look at this very quickly and see what's going on here. But if you want to take a quick look on the left side there, you'll see a W872A. That's the code that was being billed. W960, W990, W771, A005, A003. These are the codes that are being submitted. These are regular codes that people submit, and they're being rejected for whatever reason. Now, as a staff or as a physician, you got to figure out, why did this get rejected? Now you got to figure out what is EH2, what is AC4, what is ADF. You got to go back and look and see what do all these codes mean? What do I need to do now in order to fix it? Cirrus steps in, and we provide you with that information. So we look at the billing errors, and we provide action items. So we look at, what is the ARF? You needed a referral. What is the A2A? Patient was underage. All these things that we provide to you, we let you know what was the issue and what needs to be done in order to resubmit. Very simple. Your staff now saves time. They just resubmit. We provide them with that analysis back to say, these are the 5 codes or 6 codes or 10 codes that were rejected. This is why they were rejected, and this is what you need to bill today in order to fix it. And with that, they'll know for next time to double check and make sure that that doesn't happen again. But nonetheless, it will happen. Month over month, everyone is getting error reports, and we want to help you guys make sure that you minimize the loss of income based on the errors. Enrollment errors. This is a big one as well, not having the right version code. That comes up on everyone's report on a monthly basis. There's always someone that's switching a health card, a version code, and not letting you guys know in the office. This is just a simple way to know that this is what the issue is, and reach out to the patient, get an updated health card number, and move on. Get that into the system, resubmit, and you're good to go. The ministry roster report. So again, this is coming now to you through your MCEDT account on a monthly basis. Thankfully, it's not coming by paper anymore. And it's showing how many patients you have currently rostered. Now, the reason this is important, and this coincides with our roster reconciliation that we do with our physicians. The ministry says for this particular physician here, 1,373 patients rostered. Now, physician opens it up and says, oh, I thought I had 1,500 patients rostered. So now what we're going to do is a roster reconciliation. We're going to take the ministry roster here, and we're going to take your EMR roster and try and figure out where the discrepancy is. We're going to figure out who those missing patients are that are in your EMR that you believe to be rostered, but are not in fact rostered with the ministry. And this helps find a discrepancy in income. If there's 100 patients missing, great. If you're averaging $100, $200 a patient, that's a lot of money. $20,000 a year that you're missing out on that you could now have because you didn't realize that these patients weren't rostered for whatever reason. Maybe they signed up somewhere else unknowingly. Maybe they just fell off the roster because of the ministry's error, which definitely happens, as you all know. So there's so many reasons that could have happened that it's very important to do those roster reconciliations at least once a year just to see what's going on. How do we do that? We also have a roster update report, which we give on a more frequent basis to show what are the termination codes, what do they mean, which are the patients that fall into each of those sections. So if you know that a patient passed away, yeah, we're going to show you that they in fact passed away, they were removed because of that. Or if they if you terminated their enrollment for whatever reason, or if they terminated their enrollment for whatever reason, or if they're not eligible for enrollment because they don't have a valid health card number. Whatever the case may be, we provide this roster update report on a regular basis to our clients to make sure that they're aware of who's coming on, who's coming off, and who's currently on. As I said, these are the ones that were added on the previous month. So you know now what their age, the gender, annual capitation, and when they came on the roster. So some of the other Cirrus reports that we do provide based on the ministry reports is a diabetes management analysis showing you who your diabetic patients are, making sure that you're aware of how many KO30s you've billed, if they're eligible for a Q040 now based on the new requirements of having a minimum of 3 visits. We provide a billing data analysis to show all your counseling codes, your smokers, whatever the type of practice that you have, we're able to tailor make that report to show you what you are doing, what can be done differently, what can be done better in order to maximize revenue. An inside use analysis. How many of your patients are coming to see you too frequently that are rostered? If you have a 25-year-old male that's coming to see you monthly for allergy injections and they're rostered, you're making a big mistake. You need to de-roster them because you're not earning anything by having them on the roster. So we look at the flip of the outside. We're looking now at the inside to see when does it make financial sense to de-roster a patient because they're coming to see you too frequently. Special premiums, again, if you're doing home visits, if you have prenatal, if you have serious mental illness, we want to make sure that you're aware of all those bonuses that are available to you, what thresholds need to be met in order to get those bonuses, and how close you are to each of them, and when do you hit them. And then your access bonus. That sort of relates to the outside use, but making sure that you know what your max special payment is, what your outside use is on a regular basis. And this one is really good on the group level for any leads out there, giving your group visibility, potentially with names or without, to what's going on within your group. Who in the group, what percentages are they obtaining? If there's a couple physicians that are getting, 30, 40% of their access bonus, but there's a couple that are negative or a couple that are at 5%, what can they do differently in order to maximize their access bonus and maximize revenue and make sure that they can follow through and be a good team player? So that brings us to the end of our presentation for today. I really appreciate your time and taking out of your busy schedule to join me. I hope it was informative. As I said at the beginning, my contact details are right here. I would be happy to answer any questions that you may have. Please email, please call. We'd be happy to get in touch, maybe set up a meeting to discuss working with us. Or if you have any questions about anything that we discussed today, I would be more than happy to answer them. So again, thank you very much for your time today, and have a great rest of the day.